Now, America's healthcare advocate, Cary Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, from Alaska to Florida, all the way to Hawaii. Our producer today, Ms. Karen Carson. I'm your host, Cary Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. 294 affiliates strong. Thanks to all of you out there in the listening audience. Sorry, joining me in studio, Dr. Davis Brockenshire, all the way from Michigan.
Thanks for having me back, Cary.
Thanks for flying in here.
Hey, anytime.
Well, we're happy to have you in studio. Dr. Davis Brockenshire is the CEO, owner of Innovative Health Solutions. A little bit about his background. Dr. Brockenshire is known internationally as the doctor's doctor. He is a graduate of Logan University. He's been in practice for over 20 years. Dr. Brockenshire is a postgraduate instructor of applied kinesiology, neuropathy, herbal therapy, clinical nutrition, athletic injury management, pediatrics, homeopathy. Thank you very much. And is a certified blood type practitioner. Dr. B is also a board certified physical therapist and is a functional nutrition and vital functional neurology specialist. So those are all of the things that he does. Your practice is very, very different. And I'm going to kind of read the mission statement here and give you a little understanding of what they do. Wellness is not the absence of disease, but merely being absolute best you can be every day. Dr. Brockenshire defines wellness as being able to do what you want to do, when you want to do it, and how you want to do it. So the first thing I want to ask you is, how many prescription drugs do you prescribe in a week?
Well, in the last 22 years, 0.
That's exactly what I thought. So let's talk about the difference between your type of medicine, functional neurology, chiropractic, all the things that you do, versus traditional medicine. And there seems to be a wave of this going across the country. And many doctors seem to be moving away from the old models and moving toward models that are much more like this. Doctor?
That's a really good point you make, the old models. Because if you think about what I do, it's some of the oldest models in history. When you look at Chinese medicine, Ayurvedic medicine, some of the eclectic medicine from native medicines, those are thousands of years old. And what happened in America, or North America in general, because I want to include Canada in this discussion, that we have tried to control disease as a society, but we never really looked at what causes disease. And if we've learned anything over the last couple of years, it's that we really don't know what the heck we're doing from a traditional medical point of view in the hospital-based system. So when you look for a doctor or when you need a doctor, it's usually because something happened and you need help. My mission as a clinician is to help you not need that type of care.
So basically what you're saying is that when people come to you and either they come with a set of problems or they're anticipating a set of problems, whatever the case may be, you're doing a complete evaluation and you're looking for the root cause of that issue. Not, oh, you've got high blood pressure, we're going to give you these 3 medications we want you to start taking to control your blood pressure. That's not curing the cause of the blood pressure. Are they morbidly obese? Do they not exercise? Are they eating salt every day of the week? All the things that contribute to that does that contrast the way you do it with what we see in traditional medicine?
Absolutely. For example, a lot of people today, we have a ridiculous amount of testing available to us. And the healthcare...
And we love to see it build.
Yeah.
Oh, yeah.
The healthcare consumer today is in charge because as a patient or client, you can actually get your own testing done. You don't need to see a doctor. You don't need to pay your copay or your deductible. But the problem is, what do you do with the results? So I had a client recently, and his doctor said, well, it looks like Lyme disease. I said, well, how did you come to that conclusion? Well, it just looks like Lyme disease. I said, well, we have tests for Lyme disease. So we run an IGeneX test, and it does come back positive. However, just because the test is positive doesn't mean that Lyme disease is what's causing your dysfunction. So you're a person with Lyme disease, but the Lyme is not causing your seizures. Your seizures are because you got hit in the head with a baseball bat during a breaking and entering. Okay? And so because a test might say something, let's say elevated cholesterol, it doesn't mean you're at risk for heart disease. That's just one data point in this myriad of available data points. So my job is to look at all of the data, bring it together into an actionable set of data, something we can actually do something with, and use that data to improve your life, which means helping you do what you want, when you want, how you want. So at this point of the game, we don't want to use too many words. I want to help you do you. And that's as simple as we make it.
That's interesting. It's a very, very different approach because in the pay-as-you-go model, which is typically what we see in the health insurance world, in the medical provider world, in the hospital world, in the outpatient world, in the clinic world, however you want to call it, that model, which we keep trying to improve by Medicare's imposing measurement standards and all the rest of it, but it's a very, very slow process if in fact it's even working at all. Okay, and what you're talking about is taking a look at the whole person and saying, so back to your Lyme disease, they didn't know that, or they didn't take into account the fact that he'd been hit in the head with a baseball bat in a breaking and entering. Hopefully he wasn't the guy breaking and entering, I hope. Okay, and he survived it, obviously. Yes. But that turned out to be the reason he had seizures. Even though he had Lyme disease, it wasn't Lyme disease. So I'm going to ask you a question. How did you treat those two things? You didn't put him on meds. What did you do?
So in this particular case, the Lyme disease is just an ancillary finding. And when you look at Lyme, for example, a lot of people have Lyme. They don't know it. Lyme is not the cause of many problems. Lyme rears its ugly head when you get run down as an individual, just like most diseases. If you're worn out, run down and devitalized, malnourished, lack of sleep, weight gain, etc., you'll see issues with forms of disease, whether it's mono or Lyme. In his case, my job as his clinician is to keep him out of the hospital. So you don't want to have to go to the hospital these days, but yet every time...
that's not a very good place to go.
It's not, it's not the country
with
club.
COVID and everything else going on, you probably want to stay away from it.
Right. So yes, there's Lyme. Yes, there's a closed head injury. And yes, there's seizures and so on and so forth. But as a doctor, my first job to the patient is protect them, keep them safe. And as one of his team of doctors, I have to do everything I can to keep him out of the hospital. Treating him for Lyme disease has nothing to do with that. Okay? We had to put a feeding tube in this young man because he lost the ability to swallow. And that's a neurologic problem. That's not from Lyme. Okay? So forget Lyme.
Holy cow, you had to put a feeding tube?
Yeah, I know, it's wild. But again, keep the client safe. Rule number 1, don't die. Don't hurt your client/patient. And I think doctors and administrators have lost that idea, but the nurses have taken up that challenge.
That's interesting. When we come back from the break, I'm going to ask Doctor to talk about how he found out the danger and the situation this man had with the baseball bat head concussion. And I'm guessing it's probably going to have something to do with the Wavi brain scan. Stay tuned. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. The website for Dr. Brockenshire is innovativehealthsolutions.com. He treats people from all over the country. Once again, innovativehealthsolutions.com. Stay tuned. We'll be right back with more Doctors in the House.
Before our true love will be through. Whoa, tell me, darling, am I right? Am I
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. You can find out more about us by going to the website healthradio.us. My producer, Miss Karen Carson. I'm your host, Kerry Hall. All of these shows are on podcast platforms: iTunes, TuneIn, Spotify, SoundCloud, Spreaker, Odyssey. We're Apple, Google. We're on all of them. So if you want to tell somebody about I heard this show by this great doctor, you ought to go listen to this. Go to the podcast platforms. It's on all of them. It'll be titled Dr. Brockenshire. It's not going to be hard to find. And you can tell somebody about it or listen to it again if you choose to do that. It's a great way to find out, information if you want to pass it on to somebody or help somebody with it. In studio with me, Dr. Davis Brockenshire. Innovative Health Solutions is his practice. The website is innovativehealthsolutions.com. The phone number, if you wanted to call him, 734-677-2273. By the way, he does virtual care. So he's up in Plymouth, Michigan, which is close to Ann Arbor. Well, maybe you're in Florida. Well, you can do a consult with him if you want to do it virtually. A great way to introduce yourself, maybe find out if you've got issues he can help you with or recommend somebody that can. Once again, the website, innovativehealthsolutions.com. All right, so I kind of hung that out there as we got out of that last segment, the Wavi brain scan. So let's kind of, these are some of the things that you do in your practice and other clinicians around the country are now starting to do. The Wavi brain scan was invented by Dr. David Oakley. He is a 4-time Nobel laureate contributor, and David Joffe, who's the guy that invented that thing they put on your finger when you go to the ER urgent care called the pulse oximeter. So those are the two guys that did this in collaboration with Dr. Frank Palermo, who is a worldwide renowned physiatrist. And let's talk about what Wavi is and how it works and why do you use it?
Well, one of the challenges we have in healthcare today is tracking. And if you can't measure it, you can't track it. And since we are practicing an evidence-based approach, we need tools to try and track the human condition. So how do you know what's going on in that brain if you can't track it? What Dr. Oakley, Dr. Palermo, and the team have done is taken EEG and made it available in an in-office setting that's convenient, non-invasive, first of all. So you don't have to shave your head. You don't have to stay up for 4 days straight to try and induce issues. But with software and algorithms, we can use the Wavi technology to see if there's a history of any kind of old traumatic brain injury, PTSD, signs of an aging brain, signs of ADHD, OCD, anxiety, depression. A lot of times we'll see issues that don't show up until people close their eyes. So what the Wavi scan does for us as clinicians is validate what we're finding with traditional neurologic and orthopedic testing and give the patient in colored glossy photos that this is actually real. This is what you're feeling is real. It's right in front of you. You're not crazy. And as a matter of fact, the reason you're feeling that way is because of these old injuries, and we're going to treat that. So that's one of the tools we use to track and treat brain-related dysfunction.
Talk a little bit about the MP3 part of what Wavi does and how do you integrate that and what does that mean? What is MP3 and how does that tie into this?
So when we look at Wavi and we look at EEG, there's something called a P300, which is the speed at which things happen through the brain. And as the brain gets malnourished, tired, worn out, stressed, or injured, you lose the ability to process speed at a predictable rate. So what we like about the P300 is it's well referenced and it's easy to explain to people. So we don't need a PhD neurologist to read these. You can use a
although you have one available if you need it, and Dr. Frank Palermo. But
absolutely. Anyway. Recently, Dr. Palermo and I were kind of having a bro down geek session, looking at P300s on a huge screen, and he said, "Who is this? What is this? How did this happen? Whose brain is this?" I said, "Well, that's my son's." "It can't be." I said, "Why can't it be?" He says, "Well, because it's too good." I said, "You're welcome." You should see his hair. It's just as good. And every once in a while, the PhDs get surprised when they see things because as clinicians, we're seeing the average of humanity. We only see sick people. We're seeing people that need help. And when we run Wavi scans on people that wouldn't look for a doctor, you can see just how good some people are really doing. So rather than spending so much time on illness, disease, doom, gloom, we're kind of taking a flip over for the fourth quarter this year in the practice and saying, let's focus on the positives. Let's look at how great people do. Let's look at these students before they go back to college. Let's scan their brain and let's give them some good news. You're going back to college with an amazing brain. Now go and use it. Oh, by the way, you don't have ADHD. What? What do you mean I don't have ADHD?
And then get off the Adderall?
Exactly.
Yeah.
You don't have ADHD. You have a severe neurologic condition that's driven by malnutrition. You eat like crap. Oh, you mean that means something? And so a little bit of schooling. I mean, first of all, what is the purpose of a doctor but to teach? So education is the cornerstone of what we do. And I'm teaching these college students how frankly, are investing a whole lot of money in their future to get the best out of their brain in the environment they're going to be in.
So talk a little about something, and I've heard this, Steve Sanborn, who, is my partner in Neurologic, and we market the Wavi Brain Scan along with Neuro20 and some other things. One of the things that he has found and his son Stephen have found when they do these scans is one of the things that comes out of this is lack of sleep has a dramatic impact on all these pieces of the brain, but it's not seen. So the scan, the Wavi, as you said, creates a picture. It's blue and red. Mm-hmm. Okay, talk about how that lack of sleep thing translates to all these other issues that can affect your ability to function.
Kerry, if we had to do one thing for people, for their all-cause mortality, meaning if I could do one thing to help people live a better life, it's get better sleep. What we know about sleep deprivation is it's going to increase your body weight, it's going to decrease your brain voltage, you're going to feel slow, you're going to feel old, your metabolism's going to suffer.
Don't look at me when you say that.
I'm looking right at you.
Point that out, okay.
Your testosterone's going to fall. I'm not looking at you. But your hormones become out of phase. So before you spend thousands of dollars on all this incredible functional medical testing, let's maybe do a sleep study. Let's track your sleep. There's lots of devices out there that can track your sleep. You just have to wear it while you sleep. And let me just give you a case on sleep. Young guy, 48-year-old, mountain of a man, first responder, head jailer for a little town in Michigan, comes to me. He had spontaneous dementia. Okay, what do you do? His wife's freaking out. Well, it turns out that when they put him on midnights, he ended up with dementia. So we did a brain scan. He had no voltage. Yesterday, August 25th, I released him from care after a year. He has a perfect brain. He feels amazing. He's got his life back at 49 years old. And his wife is busting his chops about getting good sleep. So in 1 year, we rebuilt the brain from full-on dementia to back to work and living life to the fullest, mainly because we reinforce the sleep attitude.
So that's absolutely critical, and unfortunately, a lot of times I think that gets overlooked in today's world. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network. If you want to reach out to Dr. Brockenshire, the website is innovativehealthsolutions.com, innovativehealthsolutions.com. Stay tuned. We've got more. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. The website, healthradio.us, healthradio.us. My producer, the always perfect Miss Karen Carson. I'm your host, Kerry Hall. Dr. Davis Brockenshire in studio with me all the way from Ann Arbor, Plymouth, Michigan. Flew in here to do this broadcast today. We are very happy to have him in here. Very different what he does and how he does it. I think that's one of the reasons why his practice has grown like it has and will continue to grow. If you want to learn more about him, innovativehealthsolutions.com is the website, innovativehealthsolutions.com. The phone number is 734-667-2273, 734-667-2273. He does virtual, so if you want to start out there and maybe you find out I really need to get to his clinic and get help, you can certainly do that. But you might want to start out with the virtual if you're not in the Michigan area and see if he can help you. All right, let's shift gears now. We talked about the Wavi Brain Scan. You're using that quite a bit. That takes about 20 minutes, doesn't it? 30 minutes?
20 to 30 to do it right. Yeah.
It's that's a lot different than going and get a $3,000 MRI. Mm-hmm. And I'm not saying not to get MRIs, but I am saying that that's not always necessary. In a lot of cases, something like this, the Wavi Brain Scan, which is very unique and FDA approved, I might add, is an alternative to that can give you results depending on the issue that might be just as good.
Well, remember in medicine, it's all about the right test at the right time. And what's nice about the Wavi, it's also the right budget.
Yeah, that's exactly. Yeah. The Wavi is extremely inexpensive comparatively speaking. Let's shift gears and talk about something new. We're marketing this product out in the provider community. You're using it. You're one of our first doctors to use it. It's called the Neuro 20. Why don't you describe Neuro 20, what it does, and how it works? Because, first of all, a little background on this. This was invented by a man by the name of D.J. Watson, along with Dr. Frank Palermo, along with a couple of other people. He was a recon Marine that did 12 tours in Iraq and Afghanistan. He came back a wreck. He was at Walter Reed for 5 months. They told him, you will never be able to walk without a walker. Well, DJ's a Marine. He runs 5 miles every day now. He looks like, when he came in here and did that show, it was pretty obvious. The guy was in great physical shape and is doing very well. He lives down in Florida, and he's a great guy to work with. So talk a little bit about Neuro 20, your experience with it, how it works, and what it does. Doctor?
Well, when I was introduced to the Neuro 20 concept, I thought, this is the missing link. This is what we've been looking for to help people do what they know they need to do. So everybody knows that exercise is important. But in today's world, many of us over 40 are just too stinking tired to work out. And for a lot of reasons. And what you have to remember about exercise is your mind has to be in it. So if I said, hey, let's see how many push-ups we can do right now, I'm pretty sure everybody in the booth would be like, oh, do we have to do that right now?
No, not Steven. He's ready to go right now. Look at those.
Right. He's thinking, oh, I'm going to ace this, but he's been in the suit.
Yeah.
So what the suit does is it takes out that mental requirement for exercise. And so we call it the super suit, much like from The Incredibles. You know, honey, where's my super suit? You put the suit on. A trainer then controls the suit from an iPad. The technology of the suit is basically using electric stim. But the secret of the suit is in the software. And that's where Dr. Palermo comes in again from Wabi fame. And what we've done is create movement patterns that can be controlled by a certified trainer or physical therapist to retrain how the body moves in space and time. So one of the problems using a physical therapist or personal trainer is most people drop out of care because they don't want to do it. When you put the suit on, you don't get a choice. You're going to do it. So if I said, do a plank in the suit. Okay, I'm planking and the suit's making me plank. And you're thinking, this is great. But your brain doesn't have to think about it. So you don't have neurologic fatigue after exercise, but you get all the benefits of exercise. So in about 20 minutes, you can accomplish what would normally take about an hour of intense physical activity. Now, the reason I brought it into the office is because, and we're creating a whole new building and structure around this model. I can finally take my neurologic patients and reprogram how their brain moves their body. So we've all seen people walk funny. You know, if people watch at the airport, people move weird. And as we go through time in the modern era, we're seeing more and more of what we call digital dementia, which is what happens when people sit too much. So you see these kids and their chins are down. We call it Gru neck, you know, from Minions. Mm-hmm. And we need to get their chins up, but they don't know how to do the rehab. So we put them in the suit. In 20 minutes, their posture's fixed, their brain is fixed, and from a neurologic point of view, you can actually reprogram neural pathways. So our first case study, since we've only had it for a couple of weeks, is my dad is going to be 76, lives in Florida. He's a tough guy, but he recently had most of his right foot amputated due to medical error. So reinforce that. Medical error. I don't like it when people hurt my family because of mistakes. Rise to the challenge, Neuro 20. I bring him up from Florida. We put him in the suit. 2 days in the suit, and he's walking. He's running through the Atlanta airport to catch a flight. This is a guy that was in a wheelchair for 7 weeks. Totally atrophied the right leg. And in 2 days, he's running through the Atlanta airport.
So apply that now to somebody with a traumatic brain injury, or somebody that's had a stroke, or somebody that's got Parkinson's. These are the applications, I think, that are remarkable because they can't do, just like your father, the things they need to do. How this suit changes that whole dynamic.
The art of the suit is to take the conscious brain out of the equation. And in a brain injury, you change the way movement happens. So it's involuntary. Parkinson is involuntary. If you said to a Parkinson's patient, well, just stop shaking. You can't. In fact, if you try to stop shaking, it gets worse. What the suit does is rewire how those pathways are functioning in the brainstem and clear them, much like you tried to update your computer and it didn't work. So you just uninstall the update. And that's what we're doing. We're uninstalling those patterns in the nerve cells and recreating new nerve cells and new circulation. And as we go forward with this research, we're going to find that when you improve circulation to the brain through the muscles, you can start reversing cognitive decline and degenerative brain conditions.
So you see the application to this going far beyond just rehabbing people that have had physical injury or have had stroke or maybe have Parkinson's, but you're moving into an area where you think, this is funny because Dr. Oakley said this was, I don't know, 3 years ago. We did a show in Denver, Colorado on the WAVI scan, and he said something that shocked me. Because WAVI was originally invented to track pre-Alzheimer's and dementia. That was his whole mission. What came out of it was a whole bunch of other things he didn't know it was going to be able to do, like concussion protocol, PTSD, all this other stuff. But he said Alzheimer's, early Alzheimer's, if it's caught early enough, reasonable enough time period, it can be stopped and it can be reversed. And I made him repeat it like 2 times because I wanted, you're listening to a guy that's a 4-time Nobel laureate contributor. You want to hear what he's got to say. So go back now and take Neuro 20 and use that same idea of how you can take that Neuro 20 suit and reverse, slow down, or stop dementia, Alzheimer's in early stages, et cetera. Doctor?
Absolutely. So let's go back to 2017. A study was published at UCLA. We're calling it the Bredson study these days. And it showed that every patient with Alzheimer's was able to reverse Alzheimer's using correct nutrition, correct nutraceutical intervention, and good movement practices, meaning targeted exercise. So 9 out of 10 of these people reverse their Alzheimer's. My question then is, well, what happened to the one? You know, if 4 out of 5 dentists think that Trident is good for your teeth, hey, what's up with the one guy that doesn't? Tell me about the outlier. In every case, the person that couldn't move couldn't correct the Alzheimer's. So Neuro 20 gives us the ability to move people who can't normally move, whether they're wheelchair bound, whether they can't get up, whatever. Neuro 20 will solve that. But the bigger picture here is I have case files now where we can document the reversal of cognitive decline. And it always involves movement.
You know, and that's interesting because the whole emphasis on this in this country on reversing Alzheimer's or stopping it is being able to go after the plaque and treat it with the drug, which is what we do. What we're saying here is that that issue can be reversed without a drug.
Absolutely. And
it can be stopped or slowed down or whatever. And I'm putting you on the spot here a little bit. How far along can somebody be with that Alzheimer's or dementia, in your opinion, where you can start to slow it, stop it, or reverse it? Any idea?
At this point, if you can walk and you can talk and you know who you are, we can begin.
That's amazing. That really is remarkable. If you can walk and you can talk and you know who you are. Well, there you have it. That's a little groundbreaking information, isn't it? If you want information, you want more information, you want to reach out to Dr. I don't care where you are in the country. He treats people from all over the country. InnovativeHealthSolutions.com, InnovativeHealthSolutions.com, 734-667-2273. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network. The doctor's still in the house. Stay tuned. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. We are in studio today with Dr. Davis Brockenshire, our producer, Karen Carson. I'm your host, Kerry Hall. You know, this is a unique show I'm doing today. He flew all the way in here from Michigan to do this. When I can bring somebody on like this and talk about something as big a game changer as what you just heard Dr. Brockenshire talk about, and that's with the Neuro 20 suit and the WAVI brain scan. I don't care where you're at. If you're that person that needs help and needs hope, this is a guy who can probably help you. You want to go to the website, InnovativeHealthSolutions.com, InnovativeHealthSolutions.com. You can also call him at 734-667-2273. He does do virtual consulting, so if you want to try that and see what's going on, he would be happy to help you. Let's shift gears here. This is funny. I did a show here a couple of weeks ago with a lady named Octoria Ross, who has a lab here in Kansas City called CORE, and they do COVID testing and all the rest of it. But one of the things that she's doing that I thought was fascinating was she was doing IV therapy. And we got into this whole thing with IV therapy, which I know a little bit about, mostly because you hear about it, people going to Las Vegas and blowing their minds out, and then the next morning having to go get IV therapy so they can function. But this is a totally different approach. She was talking about a thing called the Meyer cocktail. That's one of many different pieces that she used. So talk a little bit about this, because you're doing this now, and then take it back and talk about when you were treating. This is for you folks out there that are non-vaxxers. You didn't want to get vaccinated. Well, Dr. Brockenshire treated a lot of people who didn't want to get vaccinated, still does. Talk about how you do that and how you tie this IV therapy into that, Doctor.
Yeah, Kerry, IV therapy or infusion therapy is one of the tools that we've had to bring into our facility out of a need. And what we learned over the last 3 years is there is a limit to how much nutrition you can put into the body orally. And if you've got a deficiency, let's say your B12 is low, and that can cause a whole host of neurologic problems, but you can't just take a B12 supplement and expect it to come up quickly. So we would look at a B12 shot, so on and so forth. And I partnered with a company called Veda out of Detroit. They're big in downtown Detroit. They handle the Las Vegas type crowd. So if you're going to party with Rihanna at the Grammys, you've probably run into these people. And my head nurse, Alyssa, she works with them. So we brought that into the office. We offer hydration infusions, a whole cocktail of different vitamin components, minerals, glutathione, etc. And what we've been able to do during the COVID era is give people that ability to rehydrate and recharge even while they're sick. One of the things we don't want to do is run into that so-called long-haul COVID scenario.
And that's, you need to explain what that is, because that's especially for those of us that are chronologically challenged, okay? So talk about that.
So a long-haul situation, you got sick and you didn't get all the way better. Now, what we learned this morning after reading the Journal of Neuroscience is it's real, but it's also emotional in that you got sick and now you think you did something wrong. Oh, why did I do this? I'm so scared. And part of the problem in not getting all the way better is not breaking out of that fear model. So there's a couple books that are being written about the fear and paranoia that's happened during the pandemic. And using the infusions, we can help people get ahead of that so they're not relying on oral dosing. The other thing I had to bring in was a master's of Chinese medicine who happened to be a 20-year veteran of respiratory ICU. So she's a nurse. Her name's Stephanie. She's amazing.
She's on your staff.
She's in the system. She's part of our team of healthcare ninjas. And what she's been able to do for us with the infusion therapy, using acupuncture and cupping, promote the flow of a lot of those nutrients to the right place. A lot of people who are still suffering from post-COVID syndrome are having difficulty eliminating the antibodies that their bodies actually made. So the post-COVID problem is that they just can't eliminate all the garbage their body had to create in the first place to deal with COVID. So cardiorespiratory, we can handle. Kidneys are having a heck of a time. And in Chinese medicine, the kidneys are everything. So she's able to do amazing things with needles, with scraping. We use herbs, we compound herbs, we use infusions. We're using the Neuro20 because the Neuro20 suit also does lymphatic drainage. So, as a doctor, and like you said, I've been doing this for 22 years, we literally have to keep searching for more tools to put into our system because the human body keeps getting creative in how to handle the nightmare that we've been thrust into. But I think we're doing a pretty good job so far.
Yeah, the problem is that it continues to, we continue to see this thing morph from, to BA5 to this to that, and so the question then becomes, what are we going to be dealing with this fall, this winter? Because this is not going away. I think that's the point we need to make. This is not going to go away. So what are some of the things that people can do that are preventive? Even if you're a vaxxer or you're a non-vaxxer, or I've been vaccinated 4 times, and I'll be the guy in line to get the 5th one as soon as they say it's available. But for people that don't do that, and even people that do, how much help is something like this Meyer cocktail? What is that? Explain that.
Sure. The Meyer cocktail has to do more with a B vitamin situation. A lot of the nutrients that we take are water soluble. So anybody that's taken a B complex and wondered why their urine looks like a lightsaber, it's so bright in the dark, you're passing those metabolites from the B vitamins. So what you can do with the Myers system is actually put them right into the body through an infusion. You're not relying on digestion, so you're bypassing the stomach and the liver and the small intestine. And let's face it, most people's digestive system sucks, and we know that. So why are we wasting time trying to feed them
vitamins? We're going to go eat barbecue after the show. I hope you know that. I just wanted to point that out to you.
I was promised...
I'm going to screw up your system even more after this.
I was promised meat sweats.
Yeah, you're going to have it.
Okay,
yeah.
I came to KC for barbecue. But so the Myers bypasses that. So yes, after the meat sweats at lunch, you might want to get a Myers cocktail to reload.
Yeah, that's interesting. And I really appreciate you coming in today and taking the fly down here and do this show with us, because the whole idea behind this, people, is to, I try to bring things on this broadcast that are different. I try to bring healthcare issues to the forefront. I try to bring innovative solutions. Dr. Bhattacharya's got some pretty innovative solutions. I don't care where you're at in the country. If you need help, this is the guy that can probably help you with whatever your issue is. If it happens to be, you had a stroke, or maybe you had an injury, or you're having problems with COVID long haul, you might want to reach out. The website is innovativehealthsolutions.com, innovativehealthsolutions.com. You can call them at 734-667-2273. As I said, he does virtual, so if you want to start there and see where it goes, that's an easy thing to do. Thank you, Dr. Davis Bhattacharya, for being here today.
Thanks for having me, Kerry.
And now I leave you with this thought from Dr. Albert Einstein: the one who follows the crowd usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.